Finding Your Way with Ocular Melanoma. Join me, host Tara McCannell, as I share with you everything I know about ocular melanoma. I hope you will learn, get your questions answered, and be motivated to empower your healing to live your best life. Please visit my resource page, sayhart.com/ocular melanoma. That's SEYHART/ocular melanoma for more content and support. There you will find my handbook for patients and families, past recordings of episodes of this podcast, as well as recordings of live webinars that I have done throughout the past year. Please share with people you know who may be looking for information. I hope that these resources are valuable and that people can find them easily. Today, I'd like to talk about life after radiation treatment and really just discuss some of the feelings and issues that can come up after your treatment that may be frustrating for you. So, after you have your radiation treatment to destroy the ocular melanoma that was diagnosed, there is a recovery period. And there are different phases of this recovery period. There's the immediate phase, at the time, the weeks related to your surgery, where you're having the surgery, where you're recovering from surgery. There's the month or two afterwards, and then there is 6 months or longer. And a lot of times when we're moving through the periods of recovery, it can feel very long. It can feel like this period is never going to be over with. And a lot of people wonder how they can get through this period. How are things going to get back to normal the way they were before? Because things can be so changed. There can be a lot of upheaval after eye surgery. So let's talk about some of the things that are normal and that will resolve fairly quickly. So right after you've had the brachytherapy plaque placed, and then it is subsequently removed, or if you have had other type of radiation treatment and you're in the immediate period when it is over, like within a day or so, it is normal for the eye to feel achy, sore, red, and also to have blurry vision. These are all very normal parts of your postoperative course. When the eye feels achy, the most common reason for the achiness is swelling of the tissues. And by swelling of the tissues, that means when things are kind of moved around, the eye's been turned, there's been a device placed in the socket to treat the melanoma, the eye is going to react. And it reacts by having some inflammation, and inflammation involves blood vessels that are really everywhere in the body, including the eye and the eye socket. These blood vessels will leak. And so little fluid gathers around the tissues. And if all the tissues have a little bit of fluid leaking, we get quite a bit of swelling. And it is the swelling that gives people the most discomfort. How does swelling feel? Well, your eye might feel tight. You might have a pressure sensation. You might have an achiness, especially when you move your eyes in different directions. And you might be thinking, well, my eye is patched. However, when we move our eyes, both eyes move. So no matter what you try to do, you're going to feel a little bit of this discomfort. The other more obvious thing is that the eyelid may be very swollen. And this is because when there's inflammation and leaky vessels throughout the eye socket, it affects everything. And in some cases, some people will often have swelling of their other eye, the eye that is totally unaffected. And that eye may seem droopy or swollen, or that side of the face may be swollen. We're all connected, and all the tissues in the eye sockets, in the eyelids, in your face, everything is sort of reacting. So you're going to have an awareness of the eye right after the surgery. And for some people, it can be very uncomfortable. And what you may find helpful is simple measures to help reduce the inflammation. And what are some of those things that we can do? The easiest thing that I recommend to everybody is to use ice. You can get ice chips, you can get ice cubes, crush them in a bag, hold them over your closed eye for as long as you can tolerate, and then you can stop and give it a rest. And you can do that several times throughout an hour. You can use a bag of frozen peas. And the reason I like frozen peas is because it's more malleable. You can just place it's like a little bean bag. You can place it in your eye socket and off and on, 5 minutes at a time, whatever you can tolerate. If it's hurting, you want to stop. But it is helpful to do this periodically throughout the day. So that is one way. Cold tends to reduce inflammation. When things are inflamed, there's a certain amount of heat generated, and if you can help it with cold, that helps. And the other thing I tell people too is to put your eye drops in the refrigerator. That way, when you actually put them on and use them, they're going to go on cold. And that cold also helps to soothe inflammation. Certainly, the eye drops that you may be prescribed can help you with inflammation. So, the eye drop that helps the most is prednisolone, 1%. The milky white drop that you have to shake. Sometimes people have that drop 2 to 4 times a day. That often helps with swelling in the immediate postoperative period. That's not a drop that you really want to be on for weeks on end, but right after surgery, use it as directed. Sometimes a person has so much swelling and discomfort that they actually can't even move the eye, and it is so painful. All that they can do is to just put your head in your hands and do nothing. And you can tell that there's this kind of excessive swelling and inflammation when the person can't really move their eyes in directions. And so when a person has this much swelling and discomfort right after surgery, I often recommend what we call a Medrol dose pack. It is a limited prescription of oral steroids that starts off high and is rapidly tapered. So this can offer almost immediate relief. So it all depends on what you're experiencing, but all these things that I've just described are totally normal. And you will get over this. When you're there and it's hurting and you're feeling uncomfortable, it's normal to think that, gee, I wonder if this is ever going to get over with. When am I going to recover? What's it going to look like on the other side? It can be hard, but know that this is a very limited experience, a very limited part of your ocular melanoma journey. And then we're going to move to sort of after several weeks have gone by. A lot of people still have some redness, a little bit of discomfort. This is totally normal as well. And when your ocular oncologist, your ophthalmologist examines you, they're going to look at the slit lamp, they're going to look up close. They can know what is the reason that the eye is still red or uncomfortable. What are some of these reasons? Sometimes you may have some stitches that are present. And most of the time, the stitches that we use will dissolve, they'll fall out and be gone. But once in a while, we get a stitch that just sticks around. And you may know that this is your problem. When you blink your eyes, you're going to feel something always in the same place. And sometimes some people will look in the mirror and they can actually identify that stitch. Most of the time, if this is the case, you can have your ophthalmologist remove the suture. That way, it'll be so much more comfortable. Inflammation will be less. All these irritating things in your eye, they do create some inflammation and are part of the recovery. So stitches can be one. Sometimes the eye might still be red. And what are some other reasons? You could have some lingering inflammation of the eye. And we know that this is more inflammatory because, one, your ophthalmologist might actually see cells in the anterior chamber when you get examined. You may have a lot of aching around the eye that gets worse at the end of the day. Those are kind of classic signs that the pain is more inflammatory. Other reasons that your eye could be painful and red is that maybe the intraocular pressure is elevated. And sometimes we see this, especially in the first few weeks after surgery. The pressure can go up for many reasons, and even simply being the eye is still inflamed. Now make sure that you get examined, and if it's because of elevated eye pressure, your ophthalmologist will prescribe you drops to lower the pressure and see you in follow-up to make sure that the pressure is coming down. And probably the most common reason that the eye can be uncomfortable and red is because of persistent dryness. And why would the eye be dry after surgery like this? First of all, as we get older, all of us produce less tears. There's less lubrication as we go through life. So having a surgery where tissues are slightly disrupted can make that whole thing a little worse. So do use a lot of artificial tears. The other reason for the dryness is that the surface of your eye, in order to perform the ocular surgery, has been disrupted. The tissues have been opened, and now they're closed and gradually smoothing over. So when the surface tissues of the eye are not perfectly smooth, they are going to allow your own natural tears to evaporate faster. So the eye is going to sort of dry out a little quicker than normal. So when your eye is still a little bit red, do use a lot of extra artificial tears. It just helps keep the moisture around longer and the eye is less irritable. And that also will make the redness start to go away a little faster. And then other reasons for dryness of the eye is that sometimes the eyelid may be a little droopy afterwards, and oftentimes this is something that will recover with time. And sometimes this may affect closing of the eye after surgery. All these different things must be explored with your ophthalmologist. You want to know, why is my recovery taking a little longer? Why is my eye still red? And by examining you, by asking you about your symptoms, when they happen, what helps alleviate your symptoms, all of these provide clues for your ocular oncologist, your ophthalmologist, to know what is the reason of this phase in your recovery and to give you suggestions. So, real important, if something is changing and it seems like, things are getting worse, not better, always check in with your eye care team, find out what is actually going on. And always keep in mind, even when you're in the worst of things and you're really kind of waiting for this to be over, just know that hundreds, thousands of people have gone through this and are kind of back to their regular activities. And you too will eventually get over this period. This is just part of the journey and part of your treatment. And all these things are necessary for you to do your best, to have the best vision, to have the most eye comfort, to keep your eye, and also to help save your life. And we need to do all these things to get you over this recovery period. You'll all get there, even though sometimes it might feel long and that there's a lot of transitions to think about, because everybody in some way, even a little, was going to have to adapt slightly to how the vision is changed. And even if the vision isn't changed that much, it's still the idea of knowing what you've had happen and know that you can continue on and really do most things the way you did before. So, recovery is a limited process. Understand why you're going through the different symptoms and experiences that you are, and lean into your eye care team, lean into your ocular oncologist, ask questions, make sure that you have unusual symptoms and new things that are happening to your eye checked so that you always know what is going on. Thank you for listening.